Nowadays, it's common to see couples who've been for a year or two trying to have their own children. You'll see that there is a general increase in the rate of infertility. But the question is why? So on today's episode of our health discussion, we are going to be looking at contributing factors why there is a general increase. So we are going to look at three major points that are contributing factors to the rate of infertility nowadays. If you are a couple, maybe you've been married and you've been for a year or two, please, this will probably help you. If you're thinking of having kids in the near future, this will help you as well. So for all those who are joining us, thank you so much. Please, if you're clicking on this video for the very first time, don't forget to hit that red subscribe button and click notification. Thank you so much. For those who have been here, may God bless you. The very first point which we are going to be looking at is actually age. Age is a contributing factor when it has to do with factors affecting fertility, because age is the single most important factor that affects your fertility. Reason being that a woman is actually born with all of the eggs that she needs. It therefore means that as you grow with your eggs. So a lady who is 20 years old, the eggs are 20 years old. A lady who is 30 years old, the eggs are 30 years old. So once you're born with all of these eggs. So the longer you stay, the longer your eggs also stay in you. So it is always proper that you try to have your family as early as possible. I understand that education is a major contributing factor here, and also we are trying to acquire some wealth to take care of the family, but we should try to merge the two such that this will not hinder our fertility in future. The second main reason is actually lifestyle and environmental factors. So the way we live, what we eat, what we drink is a major factor here. You will see that nowadays we live mostly on inorganic stuff, so we don't take most of the natural organic stuff. It therefore means that we are going to have a negative effect on our health and especially fertility. Just imagine the rate of smoking has increased, the way youth smoke increased, the way we drink alcohol has increased, the way we take caffeine, and caffeine also here will go for education, because when you're studying, maybe you'll be trying to take coffee such that you can stay alerted, but this will affect your fertility negatively. So our lifestyle, what we eat, what we drink, chemicals that we consume, environment that we are living in is a contributing factor to the fact that we have an increase in infertility nowadays. The third point, which is our final point for today, is actually an increased rate of consuming pills, that is pregnancy prevention pills, and an increased rate of abortion as well. So because there is an increased rate of pills, we consume pills probably when we've not even started to have a family. Just imagine you've not had even a kid, but you're consuming pills continuously. This will have a negative effect on your fertility and abortion as well. So you may have maybe 2, 3, 4, 5 abortions. This is going to hinder your fertility as well. So if you're a young lady watching, if you are a young man, or if you're a couple that you just got married and you probably are looking to have your own family in future, please make sure you take all of these points seriously.